Good day everyone, we are the group 8 and our topic for today is about exercise program. Exercise programs are popular. There are gyms and other fitness providers with many different types of classes, exercise routines and equipment, catering to a wide range of people. Health benefits of exercise programs. An exercise program that is tailored specifically to your needs is a great way to stay physically and mentally fit. It also provides additional benefits such as improved condition of the heart and lungs. It increases muscular strength, endurance, and motor fitness. Motor fitness is important to the athletes because it decreases the risk factor of injuries while they are playing. So next is increased aerobic fitness. Next one is improve muscle tone and strength, weight management, better coordination, agility, and flexibility, improve balance and facial awareness. Spatial awareness is the ability to understand and interact with the surrounding, whether it be avoiding obstacles and many more. It all increase energy levels. So when you exercise, mas dumadagdag or dadagdagan yung energy levels ng katawan mo. Next is improved immunity. Physical activity may help flush the bacteria out of the lungs and airway. This reduces your chance of getting flu or getting a cold. The next one is increased physical confidence. Reduce risk of chronic disease such as type 2 diabetes and heart disease. It also improve your sleep, improve brain function and health, improve general and psychological well-being, greater self-confidence and self-esteem, and improve social life. Because when you exercise, you interact to other people who exercise within that ground. Before starting your exercise program, before you get started, if you are new to exercise or coming back from a long period of inactivity, it will help if you complete the physical activity readiness questionnaire or Part Q. If you answered yes to some of the questions in the screening tool, see your doctor or allied health professional. The Part Q questions consist of: has your doctor ever said that you have a heart condition and that you should not only do physical activity recommended by a doctor? Do you feel pain in your chest when you do physical activity? Is your doctor currently prescribing drugs for your heart condition? Those are the examples of questions in the Part Q, and this is answerable by yes or no. So if you answered yes to any questions, talk with your doctor before you start engaging in physical activity. And if you answered as no to all Part Q question, you can start practicing or participating in any physical activity. Next is assess your current fitness level using the following information or make an appointment with an exercise professional for a fitness assessment. Assessing your fitness level for an exercise program. You probably have some idea of how fit you are. However, assessing and recording baseline, starting fitness scores can give you benchmarks against which to measure your progress. It's valuable to assess your progress on a regular basis. For example, each month remembering progression with some goals may be achieved in shorter or longer periods of time. Before you start your new exercise program, record your pulse rate before and after a walk. So when you walk, kung pag naglakad ka, check your heart rate before you walk. So if it's mabilis ba to or mabagal, and after mo maglakad, bumilis ba or nagkaroon ba ng changes yung pulse rate or heart rate mo. Kung kanina mabagal bago ka lumakad, gayong pagkatapos mo maglakad, bumilis ba to or hindi. Something like that. Next is how long you take to walk a certain distance. So, how long, gaano nga ba kahaba yung nalalakad mo in a certain distance? How many bench push-ups or squats you can do in 30 seconds. Your waist circumference measured midway between the top of your hip bone and bottom of your ribs. Your body mass index, this is calculated by dividing your weight in kilograms by your height in meters squared. If you would like this accurately assessed, visit your local registered allied health professional. So, kung hindi ka sure sa naging result o sa pag-calculate mo ng BMI mo, you can go to your barangay, local barangay health and to other exercise and your other exercise professional. Go with them so that they can assist you to know your body mass index. Next is designing your fitness program. Consulting an exercise professional when designing your fitness program can help you reduce injury and customize your program to your needs. Especially if you are new to exercise or you haven't done any physical activity for a while, points to keep in mind when you designing your program include consider your goals. So your goals might be you want to lose weight. That's why you do a fitness program. So gusto mong pumayat kaya ka design ng fitness program mo. Or gusto mo mag-start ng fitness program dahil gusto mong pumayat or dahil gusto mo lang maging fit and healthy kaya gusto mo mag-exercise and something like that. Next is think about your likes and dislikes. So, kung gusto mo yung exercise na yun, or if you have any exercise na gusto mong gawin, do that kasi alam mong mag-enjoy ka doon. But don't choose you doesn't like exercise kasi you will not enjoy doing that activity and mapapagod ka lang. Plan a logical progression of activity. If you're just beginning to exercise, start cautiously and progress slowly. So, kapag nagsa-start ka pa lang, baguhan ka pa lang, you need to start cautiously. Kasi pwede kang ma-injured or magkaroon ng any other conflict or problems kapag hindi mo siya dinahan-dahan. So, your progress will be slowly, but magiging maingat and hindi ka magkakaroon ng injury. Next is build activity in your daily routine. Schedule time to exercise as you would any other appointment. So for example, when we go out, we do nagkakaroon tayo ng other appointment. So nagkakaroon tayo ng schedule. So just like when going out, we also need a schedule for our fitness program. So para hindi natin nakakalimutan na mag-exercise dahil meron tayong schedule time for our own exercise for our fitness program rather. Next is think variety. By varying your activities, you can avoid exercise boredom. Allow time for recovery after exercising and make sure you have an adequate healthy diet. So when you exercise, you also need to eat healthy food and do a healthy diet also. Next is put it on a paper. A written plan can encourage you to stay on track. About the guidelines. Staying active regularly is essential for good physical and mental health and well-being. This is true no matter how young or old you are, but the amount of activities varies depending on your age. So katulad namin na mas bata pa, mas malakas pa, and mas marami pa kami kayang gawin na activities or exercise. But when you age 40, 50 and above, mas nagiging onte yung kaya mong gawin dahil yung katawan mo is not that just strong just like ours. And so you need to choose activities varies on your age. To help you understand and how much activity you need, below is a develop physical activity and sedentary behavior guidelines for each age group and for pregnancy. These guidelines outline how much physical activity you should do each day. Ilang activity nga ba yung kaya mong gawin or kailangan mong gawin sa bawat araw. Next is ideas to fit more physical activity into your daily lives. Next is the importance of reducing and breaking up the time you spend sitting or lying down when not sleeping. Next is how much sedentary screen time is recommended. How much sleep children and young people should get. So based on the research and the doctor said that the amount of sleep the children should have is the minimum of 8 hours. Next is how children and young people can get good quality of sleep. And that's the guidelines.
Good day everyone. My name is Natasha Isabelle G. Orindain, and my topic for today is about physical activity guidelines by age for adults 18 to 64 years old. Let's talk about its benefit. Being active helps you stay physically and mentally healthy. The more active you are, the more you benefit. For adults, being active regularly can reduce the risk of or help manage type 2 diabetes and cardiovascular disease. Next, maintain or improve blood pressure, cholesterol, and blood sugar levels. Next is reduce the risk of some cancers. Next is prevent unhealthy weight gain and help with weight loss. Next, maintain strong muscles and bones. Next, create opportunities for socializing and meeting new people. And last, help develop and maintain physical and mental well-being. So next is the recommendations. Adults should be active most days, preferably every day. Each week, adults should do either 2.5 to 5 hours of moderate intensity physical activity, such as a brisk walk, golf, mowing the lawn, or swimming. Next is 1.25 to 2.5 hours of vigorous intensity physical activity, such as jogging, aerobics, fast cycling, soccer, or netball. An equivalent combination of moderate and vigorous activities. Include muscle strengthening activities as part of your daily physical activity on at least 2 days each week. This can be push-ups, pull-ups, squats or lunges, lifting weights, household tasks that involve lifting, carrying, or digging. Doing any physical activity is better than doing none. If you do not know physical activity right now, start by doing some, then slowly build up to the recommended amount. Let's proceed now to building activity into your day. Physical activity doesn't have to be structured. Making some small changes to your daily routine can make a big difference. For example, you could walk or ride your bike for short trips instead of driving. Next, you can drive to a park and ride spot and walk or ride your bike the rest of the way. Next is use the stairs instead of the lift or escalator. Get off the bus one stop earlier and walk the rest of the way. Next, you can park further away from your destination and walk. And last, you can walk to the park to eat lunch. And now, let's talk about limiting time sitting and lying down. Long periods of sitting can offset the benefits of being physically active. So it's important to reduce the time you spend sitting. For example, by organizing walking meetings, using a standing desk, or enjoying a walk during your lunch break. Next is break up long periods of sitting. For example, by doing lunges or star jumps or walking around when on the phone. This ends my report. Thank you for listening.
Good day everyone. My name is Glaiza Saclet, and today I'm going to discuss the physical activity guidelines by age for children and young adults 5 to 17 years old. So being active. For children and young people, being active every day has an social, emotional, intellectual, and health benefits, including a chance to have fun with friends and family, reduce antisocial behavior, stronger cooperation and teamwork skills, better self-esteem and confidence, lower anxiety and stress, better concentration, healthy growth and development, strong muscles and bones, improved fitness, including coordinations and movement skills, lower risk of disease, lower risk of unhealthy weight gain. All children and young people should get the right mix of physical activity, inactivity, and sleep in each 24-hour period. So regular physical activity can help our children and adolescents improve cardiorespiratory fitness, build strong bones and muscles, control weight, reduce symptoms of anxiety and depression, and reduce the risk of developing health conditions such as heart disease. So now, let's move to moderate to vigorous physical activity. We recommend children and young people to do at least 60 minutes each day to moderate to vigorous physical activity that makes the heart beat faster. More is better. It doesn't have to be a full 60 minutes at once. Several shorter sessions through the day work too. At least 3 days per week, children and young people should incorporate vigorous activities and activities that strengthen muscles and bone in the 60 minutes. These activities don't have to be organized or formal and can include football, basketball, netball, bike riding, scooter riding, swimming, and dancing. So let's move to muscle strengthening activity. As part of 60 minutes of daily activity, we recommend children and young people include muscle and bone strengthening activities 3 days per week, like running, climbing, swimming on monkey bars, push-ups, sit-ups, lifting weights, yoga. In light physical activity, children and young people should also do several hours of various light physical activities each day. This can include walking to school, walking the dog, going to park with friends, helping around the house, playing handball. Ensuring good sleep. Getting enough good quality sleep is essential to healthy growth. We recommend that each night, children aged 5 to 13 years old get 9 to 11 hours of uninterrupted sleep. Young people aged 14 to 17 years old get 8 to 10 hours of uninterrupted sleep. To establish the maintain healthy sleep patterns, it is recommended to have a consistent bedtime and wake-up time. Avoid screen time 1 hour before sleep. Keep screens out of the bedroom. In monitoring progress in your exercise program, Assess your progress 6 weeks after you start your program by measuring the same parameters as you did to record your baseline fitness. And then every 8 to 12 weeks, you may need to adjust the time, intensity, and type of exercise you do to continue improving. On the other hand, you may be pleasantly surprised to find that you are exercising just the right amount to meet your fitness goal. That's all. Thank you.